This is a short story about a deadly outbreak in a tropical country. All characters and other entities appearing in this work are fictitious. Any resemblance to real persons, dead or alive, or other real-life entities, past or present, is purely coincidental. Thank you for watching and do leave a comment to let us know what you think.
It was a hot and humid day in June, and Dr. Aziza had just arrived at the hospital Bandar Buloh, a primary referral hospital for infectious diseases in the country. The hospital was a large complex of buildings, with gleaming white walls and a sprawling campus. It was surrounded by lush tropical vegetation, and the sound of birdsong filled the air. Inside, the hospital was modern and well-equipped. As Dr. Aziza walked through the hospital corridors, she felt a sense of excitement. She had just been offered a position as a specialist trainee in infectious diseases, and she was eager to get started. Dr. Aziza was a charming and attractive young woman, with a sassy sense of humor and a deep passion for her work. She was highly ambitious and eager to make a name for herself in the field of infectious diseases. As she arrived at her office, she found her mentor, Dr. Wong, waiting for her. Dr. Wong was a highly respected specialist in infectious diseases, and Dr. Aziza had been fortunate enough to have been selected to work under him. "Good morning, Dr. Aziza," said Dr. Wong. "Welcome to Hospital Bandar Buloh. Are you ready to get started?" Dr. Aziza smiled. "Absolutely," she replied. "I'm eager to learn." "Excellent," said Dr. Wong. "There's a lot to do, so let's get started." Together, the two doctors set off to begin their work. Over the next few months, Dr. Aziza worked tirelessly to learn everything she could about infectious diseases. She studied the latest research, worked alongside experienced doctors and nurses, and dedicated herself fully to her work. Little did she know, she was about to be called upon for one of the greatest challenges in her career. It was like home to her, and she knew every corridor and room like the back of her hand. However, there was something unsettling in the air. Something seemed different this time around, and it worried her. As she walked down the brightly lit corridors, she saw an unusual number of patients lining up in the waiting room. It was nothing like she had seen before. She stopped at the patient's room and listened intently to their coughs, trying to determine the cause of their illness. It was then that she realized that there was a new viral outbreak, and it was highly contagious. The new virus had started to spread rapidly across the country, causing widespread panic and alarm. The virus was highly contagious and deadly, and there was no known cure or treatment for it. She immediately rushed to the hospital's administration office, hoping to get some answers and directives on how to address the situation. However, to her surprise, her superiors were confused and could not come up with a cohesive plan to combat this new pandemic. Politicians came up with conflicting and equally confused advice, like drinking warm water to kill the virus. She couldn't believe it. All her years of hard work and the establishment of her reputation in the hospital were thrown out the window. The bureaucrats and government officials were only interested in advancing their own interests, regardless of the risk it had on the patient's welfare. But Dr. Aziza was made of strong stuff. She remained focused and determined, and refused to let anyone stand in the way of her work. She pushed back against the bureaucracy and the politics, determined to do whatever it took to protect the people of Malaysia from the deadly virus. As the weeks went by, the situation continued to escalate. The number of cases of the virus grew exponentially, and there were reports of people dying in the streets. But Dr. Aziza refused to give up. She worked tirelessly, day and night, doing everything in her power to help those who had been affected by the virus. By December, a vaccine had been developed to combat the virus. People, however, were still dying, and many, especially the frail and elderly, were very worried about taking this new vaccine with unknown side effects. The situation was not helped by anti-vaxxers spreading fake news and misinformation on the social media. Dr. Aziza realized that this was going to be one of the biggest hurdles in combating the pandemic, dealing with anti-vaxxers. Dr. Aziza spent hours poring over research articles and data related to the new virus. She knew that the key to combating the virus was through public education and awareness. She immediately started to build her social media campaign, creating posters and infographics that she could share on various platforms. She wanted to spread the word about the virus and the importance of vaccination to the wider population in Malaysia. The situation was made worse by the fact that there were also people who were against masking. They believed that the virus was not real and that the government was simply trying to control them. Many were also swayed by proponents of fake treatments like animal deworming medication. Dr. Aziza knew that this was a dangerous mindset, and she continued to work hard to dispel these myths. She appeared on various television and radio programs to talk about the virus, dispelling myths, and the importance of getting vaccinated, wearing masks and hand hygiene. These were simple public yet highly effective public health measures that needed to be implemented in order to combat the pandemic. Despite the challenges, Dr. Aziza didn't give up. She continued to create content and engage with the public, answering questions and dispelling myths related to the virus. By the end of the day, Dr. Aziza was exhausted but determined. She knew that this was only the beginning and that there was still a lot of work to be done to combat the virus and educate the public. Slowly but surely, her efforts began to pay off. The spread of the virus began to slow, and eventually, it was brought under control. Dr. Aziza stepped out of her car, her white lab coat fluttering in the wind. She looked up at the gray, overcast sky above her. It was monsoon season, and the rain was pouring down heavily. The ground was muddy, and puddles were forming on the pathway leading up to the hospital. The outbreak was subsiding, and life in Malaysia was slowly returning to normal. But Dr. Aziza was not content to rest on her laurels. She knew that there was still much work to be done to ensure that the country was prepared for future outbreaks of infectious diseases. She worked tirelessly to push for reforms in the healthcare system, lobbying the government to allocate more resources to infectious disease research and prevention. She also became a vocal advocate for better training and support for healthcare workers, believing that a well-trained and well-equipped workforce was essential to stopping the spread of infectious diseases. But along with her newfound fame came challenges. There were those who criticized her approach, accusing her of being too aggressive and too willing to challenge the status quo. And there were those who sought to discredit her, questioning her credentials and her abilities. But Dr. Aziza refused to be deterred. She knew that her work was too important to be undermined by politics and petty rivalries. She remained steadfast in her commitment to her patients and to the larger mission of protecting public health. Through her efforts, Dr. Aziza became a powerful voice in the healthcare community, respected for her expertise and her unwavering dedication to protecting the people of Malaysia. Dr. Aziza had proven herself to be a true hero of Malaysia, a dedicated and tireless advocate for public health and a shining example of the best that the healthcare profession had to offer.